Nick, if you could just comment on the testimony you've heard and comment on the fact that, based on your experiences in Manchester, do you see, what do you think of the testimony from the Secretary, first of all, number one, and number two, am I missing something? Is there an appropriate way to refer people out like that? And is it being done? And if it isn't, why not? And should it be done?
Senator, listening to the testimony so far, there's a couple things I'd like to comment on. One is the hiring practices, saying it's hard to recruit and fill these positions. There's barriers that are on the front lines that aren't being heard at this level up here, such as when these special purpose funds come in, they're for X number of years, 1, 2 years, whatever it may be. And a lot of facilities, many facilities, not just Manchester, those positions were then being listed as not to exceed 2 years or not to exceed 1 year, to be able to go along with the special funding so that they didn't have to worry about their budget in the future, and instead gave them the option to opt out. So if I'm a psychiatrist or a mental health clinician, why, especially in this economy, am I going to leave a full-time position to go to work for the VA if it's not even guaranteed that I'm going to be there in 2 years or that position is going to be there in 2 years? That's the reality. That's just one of many examples that the front lines are encountering in trying to get people in there. And secondly, when you're talking about the fee service, it felt in where I was at, let me qualify that, it felt where I was at that the fee service was saying that our system was not adequate. So we're not going to send people out if we can't deliver this care that we're so very proud of that we offer. And then when they were feed out, the problem that says is in the Uniform Handbook, the Uniform Mental Health Handbook, it says that the VA is then responsible for ensuring the care management of those people out in the community. And that wasn't even evident either, because we didn't have even the personnel to do that.
Well, thanks for that insight. Also,